IND podcast. I'm your host, Dennis Dunicic. Now, as always, I want to remind you to subscribe to our channel to stay in the loop on all of the international affairs that are occurring today. Now, let's get right into our main story today, which concerns coronavirus. Now, we're going to be posing one specific question here. Is the virus finally over? Or more specifically, our restrictions and our way of treating the virus, which so far has been lockdowns, mask mandates, social distancing, and other fun legal measures that prevent us from living a normal life, is that finally over? And are we going back to a normal life? Now, many countries in the West seem to believe so, particularly those in Europe and the Americas. Many European countries, such as those in Scandinavia, Norway, the Netherlands, Germany, the United Kingdom, and the United States in America, have decided to take a much lighter approach to COVID-19. And this comes at a very, very interesting time, when COVID-19 infections have actually never been higher. And the reason for the high amount of infections is actually because of the Omicron variant. Now, the Omicron variant, as many of you probably already know, is extremely infectious. It is especially effective at infecting people who would typically be immune or have some kind of resistance to the virus, either through vaccines or because they've already been sick from COVID-19 and recovered and have natural antibodies. Omicron tends to kind of evade these antibodies or other things inhibiting it from infecting a person and still infects people. Because of this, infections have never been higher. Just to understand how infectious the variant is, we can look at the last 10 weeks since the Omicron variant became the dominant strain of coronavirus in the world. In the last 10 weeks, there have been more infections than in the entire year of 2020. Now, what is interesting is that is the first year of the pandemic, and that's only 10 weeks, comparing it to the last 10 weeks. However, hospitalizations and serious illness are significantly down, and death is decreasing as well. The reality is while Omicron is much more infectious than other variants of the COVID-19 virus, it is significantly less likely to cause serious illness, to cause hospitalization, and to cause death, which is the main reason we're avoiding the virus. We would never have reacted to COVID-19 as strictly as we did if it wasn't dangerous. If it was just a virus that we got infected by, it didn't cause us symptoms, it didn't cause serious illness, and it didn't cause death or hospitalization, there's a good chance we probably would not have noticed COVID-19 in the first place. There are probably countless viruses that go around the world every single year and every single day, and we don't notice them because they don't cause us symptoms. Now, many countries, because of this fact, have chosen to take a much lighter approach to corona and have began to completely return life to normal. A very notable example is the United Kingdom and England. So in Britain, life is almost essentially 100% back to normal. There are no mask mandates, there are no social distancing mandates, there are no lockdowns, no work from home orders, and there are no more uses of the famous and dreaded COVID passes, which forced you to prove that you were either that you've had COVID-19 and have natural antibodies to the disease, or that you are vaccinated and have a resistance to the disease. These are no longer being put in place. Life in the United Kingdom is virtually completely back to normal. The only mandate that still does exist in Britain is that if you test positive for COVID-19, you do have to self-isolate. Besides this, nothing else is as it was during the pandemic. Life is completely back to normal. Many European countries are taking the same approach. One, because people are fundamentally sick of the COVID-19 pandemic. Not literally, people were getting sick and people were dying and people were having respiratory issues, but people were politically sick of having their freedoms restricted for good reason, to prevent virus and prevent unnecessary death, but people were sick of having their freedoms restricted, and economies were suffering because of it. Now these countries are returning back to normal. That being said, the World Health Organization has stated that while countries can absolutely begin to roll back on some mandates and on some restrictions and slowly bring life back to normal, these decisions need to be made on a medical basis, and they cannot be put under political pressure or forced or rushed. And the reason why, the World Health Organization recognizes that the COVID-19 Omicron variant, which is the dominant variant in the world today, is much less likely to cause death, cause hospitalization, or cause any kind of problems on the medical systems of various countries. Now, that being said, it's not Omicron that we're trying to prevent. What is a possibility, and it's a small possibility, but it is a possibility, because Omicron is so infectious and it infects so many people in such a small amount of time, millions in periods of days. What that means is that another variant of the virus could come out that does cause serious disease, that does cause hospitalization, and that does cause death at a much higher level. Now, I don't want to sound like an alarmist, and I'm not. I don't believe that that's going to happen, but it is a possibility. And the World Health Organization is an organization that is primarily directed by medical professionals, doctors, epidemiologists, and other people that work in medical fields. Their decisions and their recommendations are not based on political angles or based on economic angles, but they are based on purely medical scientific angles. So they are not going to take things into account like the political aspect of not having life be back to normal or the economic aspect of having economies be shut down. From a purely medical perspective, it is dangerous to lift restrictions. That is factual. But many Western European countries and the United States have just said, you know what? It's worth the risk. We're sick of this pandemic and we want life to get back to normal. But not every country has been on the same page. Now, the World Health Organization, while what it initially says to not lift restrictions, etc., can be controversial, does have a very good point. Countries that do want to lift restrictions and bring life back to normal can do so. But what should be there is a high level of vaccination, ideally one that is higher than 70%, and a medical system and healthcare system that is able to take any kind of influx or a higher level of COVID-19 infections. Now, advanced Western countries that have more progressed medical systems and have a high level of vaccination can absolutely do this. But many other countries just want to be cautious. Now, countries like Italy and Greece have actually not began to roll back on restrictions, but have introduced more restrictions. In Italy now, anyone over the age of 50 years old, as of next Monday, is going to be charged a €100 fine if they are not vaccinated. In Greece, there is also a fine for people over the age of 60 that are not vaccinated. In addition to this, in Italy, you cannot enter a bank or a post office without proof of vaccination or a PCR test that was done in the last 48 hours. Now, these are not necessarily restrictions on vaccinated people. What they are is restrictions on unvaccinated people. And it's not that Italy wants to change lives or Greece wants to restrict lives. What they want to do is convince people to get vaccinated, because the higher level of vaccination there is, the less risky it is to go back to normal everyday life. And these are vaccine mandates. Now, €100 is not the end of the world. It's not going to financially bankrupt someone, but it's still a fine that does put a little bit of pressure or coercion on someone. Now, the king and inventor of vaccine mandates is Austria, which introduced the world's first obligatory vaccine mandate. Now, Austria has actually began to roll back some of its restrictions, as Austria also recognizes that life can come back to normal. Now, the United States itself is a completely mixed bag. Generally speaking, COVID-19 is not a topic that is on many people's minds, and people have been living life as if it's completely normal here for a pretty long time here. Life is back to normal, and people have been living with the COVID-19 virus as if it is endemic. Now, there are some exceptions, right? New York State recently tried to introduce a significant amount of measures and even lockdowns and restrictions on people in December. But these measures were never able to be introduced because they got held up in court, and the court has yet to make a decision on them, which is fascinating. It's a virus that's rapidly going and changing dynamically, but the decision on what to do and how to react to this virus, which should be done on a day-by-day basis, is stuck in a courtroom for the last 3 months. But nonetheless, life is relatively back to normal in the United States. So we can come to the conclusion that most European countries, America, Canada, countries in the Americas, are ready to begin living with the virus. But a completely different story and a completely different approach is being taken by the vast majority of Asian countries, except Japan. Now, Japan, in my opinion, is a nation that everyone should copy when it comes to reacting to the COVID-19 virus. Japan has rarely used coercion or lockdowns or force to get people to get vaccinated or to respect mask mandates or social distancing. What the Japanese government is doing now, there are no mandates, nothing is obligatory, but the government is just asking people, listen, you don't have to do it, nothing is legally obligated, but if you could, wear a mask and respect social distancing. And people actually do that. When people are not coerced, they are more likely to follow general pandemic protocols. Now, that's Japan, okay? The rest of Asia, despite having significantly higher vaccination rates than the rest of the world, has been much more restrictive than its other global counterparts. Now, one reason for this, a lot of people argue, oh, those countries aren't fully democratic, so they just want to restrict people's rights. It's not actually the case. The reason that Asian countries, generally speaking, are much more reactive to COVID-19 and coronavirus is because they're used to it. Now, Asia is no stranger to respiratory illnesses, epidemics, or even pandemics. Asia has had to react to viruses like MERS and SARS, or Middle East Respiratory Syndrome, or severe acute respiratory syndrome. They are used to reacting to respiratory ailments and illnesses, and they are used to having strict measures to prevent them. China, for example, despite having a very high vaccination rate of above 80%, has a procedure in place that anytime one COVID case is detected in a specific area or a city, that city and area is completely locked down and quarantined for a period of time, which is about as restrictive as it can get. And that is still happening even on the eve of the Winter Olympics, which are being hosted by China. Now, other countries like Singapore, for example, still does have restrictions in place. And Singapore is extremely unique. Singapore has the most dynamic approach to COVID-19. Now, the goal of the Singaporean government earlier last year was actually to become a COVID-resistant country. These are the words of the Singaporean government, not myself. Now, what being a COVID-resistant country means is having a dynamic response to the COVID virus. When there are more infections, more restrictions are introduced. When the virus is going down, restrictions are relaxed. And this is constantly changing. Now, the reason that I bring this up based on Omicron, even though, as I mentioned before, is more infectious, though significantly less likely to cause disease or death, which is the main thing we're trying to avoid here. Not coronavirus itself, but death and disease is what we're trying to avoid. They have not let the fact that it's much less likely to receive serious symptoms or die from the Omicron variant to affect their decision whatsoever. They're treating Omicron as if it's just any other variant of the COVID-19 virus, taking as much precaution as they possibly can. Now, a very unique yet sad kind of point to make is Omicron has become so infectious that it has actually, in this last month, in January, managed to infect the one of the countries on Earth and one of the areas on Earth that throughout the entire pandemic did not have a single case. And I'm talking, of course, about the island nation of Tonga. Now, Tonga recently experienced two natural disasters that really shook and damaged the country. A volcanic eruption followed by a series of tsunamis and heavy waves. Now, some Tonga relief workers who were sending out packages to relieve people that were affected by the tsunami and the volcanic eruption were found to test positive for COVID-19. Two of them. Only 2 people have tested positive for COVID-19 in Tonga. And the entire country, the island nation, has introduced a nationwide or island-wide lockdown, a complete lockdown and quarantine to make sure that the virus does not spread. Now, this may seem extreme and excessive, but the reality is that 1, Tonga has not had a single case of COVID-19 throughout the entire pandemic. This is its first and second case of COVID-19. And 2, Tonga is an island nation that only has a population of 105,697 people. 2 cases can quickly turn into 4. 4 cases turns into 40. 40 turns into 400. 400 can turn into 4,000. And now you've already had 4% of your population infected, and that can happen in a matter of months. Now, that lockdown is there. And this shows a striking contrast between Western and European and Anglo-Saxon and American countries that have been taking a more casual approach to COVID-19 and saying this is endemic, we're going to live with it, and Asian countries that have been saying we're not going to take any risks. Now, the World Health Organization continues to say that the Omicron variant is significantly less dangerous than other variants of COVID-19. However, it is possible, as I mentioned before, that a new variant can arise because of the spread of Omicron and from Omicron that is just as dangerous. And before I end the report today, it is important to say, when comparing deaths from last week to the week before, so the last week is January 24th to January 30th, comparing the deaths from January 24th to January 30th of that week to the deaths in the previous week, the deaths are actually 9% higher. Now, 9% is not enough to say, oh my God, there's a new variant, people are dying, but it can be indicative of what is to come. Now, in my opinion, I do think that we should begin living with the virus endemically. Nonetheless, we should take some basic precautions, such as wearing masks when we have to and social distancing when we can. In addition to that, getting vaccinated is not a bad idea. I myself am vaccinated. I don't believe in any kind of mandates or forcing people to do anything, but it should be encouraged because we all want life to get back to normal. Lockdowns are not good for widespread mental health. They're not good for society, and they're terrible for economies, and life does need to get back to normal. But if we are too reckless and these restrictions are lifted based on political force or just rushed out, we could find ourselves in a situation where a new variant arises and brings us back to square one. So day one of the pandemic, and the pandemic, COVID-19, has been around for roughly 2 years. In those 2 years, it's estimated that anywhere between 360 to 370 million people have been infected by the virus. Of these number of infections, 5.6 million people, at least, have died of COVID-19. So this is a serious virus. It needs to be taken seriously, but hopefully, it's fucking over, because I'm sick of it too. Anyways, let me know what you think in the comments section. Do you think that countries should take a more endemic and nonchalant and casual approach and simply accept the fact that we are now going to have to just learn how to live with this virus? Or do you believe that we should be more cautious and just have lockdowns and measures and other types of restrictions? Tell me exactly what you think in the comments section. Let's have a nice and open debate. I don't care if you agree with me or disagree with me. It's just good to see what you think. Like, comment, and subscribe. I'll see you next time.